Okay, the second concept I'm going to go over with is prioritization and delegation. Delegation, yeah, maybe a little, maybe, but prioritization for sure. For sure. All right. Now, one of the concepts, I have 2 pages of concepts here. Now, if you really want to pass the NCLEX, you're going to have to get help from someone like me for tutoring. Tutoring is very helpful if people are taking it for the first time or if they're repeat test takers. I love a face-to-face. I love that one-on-one. And it's been very good for me to help people. They love it too. I can tell by the results. All right. Now, I have a lot of concepts here. I'm only going to go over 5 for the purpose of this video. If you want more, I hope that you get in contact with me so I can tutor you. Now, one of the major concepts that I've come up with is a lot of people have failed their NCLEX because they picked pain. And I want you to remember this. I want you to remember that pain is a psychosocial need that comes after physiological needs, right? Physiological needs always, always, always come first. So, I don't care if the client needs their pillow fluffed because their neck is out of alignment. Okay? Fluff the pillow. It's a physiological need. Psychosocial needs come after physiological needs. And pain is a psychosocial need. Alright? Let me see what else. This is an important one, and I'll show it to you in a example, but you really won't be able to understand it unless you get some tutoring. I don't know. Let me share it with you. You might be able to understand it. So here it goes. It says to pick acute symptoms over chronic symptoms. Pick acute over chronic. Concept number 2. Concept number 3. Never pick the symptom of the disease. Never pick the symptom of the disease. All right, let's see what else I have here. When another member of your team is mentioned in the question, always pick the scope of practice that is of that member of the team, not you, the nurse. In other words, if the question says the nurse will refer blah, blah, blah to a social worker, I want you to think to yourself, why do I have to refer blah, blah, blah to a social worker? What is that social worker's scope of practice? Okay, not yours, the social worker. And this is collaboration. Often in the medical field, we work together. We collaborate together. Collaborating is not delegating. All right. Speaking about delegation, I'll mention a few things you can't delegate. Okay? You can't delegate the first initial assessment. You can't delegate your patient until your patient is stable. I will say if you have an RN that you need to pull to the neonatal unit and that RN has never worked the neonatal unit, you can delegate the harder client to the more experienced LPN. This is one of the only times you can delegate something like that to an LPN. Experience trumps the RN if the RN is new. Let me think while I'm on that subject. You can't delegate teaching, okay? If the NCLEX says, what would you expect to be a correct understanding of the teaching? Don't delegate that. You can't delegate the making of the care plan. Okay, you can't delegate education or what I like to say evaluation, because we have to go back and we have to make sure that our plan of care worked. And the way we do that is to evaluate. So don't delegate that to another nurse. You keep that. Like they say, the beep rolls uphill, right? The buck stops with you, the RN supervisor, right? So don't delegate things that until they're stable. Even LPNs, let me talk to you for a minute. Even if you know that your aides can take vital signs, do not delegate that vital sign, for example, to a new admission that had a head injury. All right? Don't delegate even what the aides can do until that patient is stable. If you have somebody coming in because they haven't eaten in 4 days, 5 days, whatever the case may be, you don't want to delegate the intake and output to the aide, who is very capable of doing that. But the problem is, it is a new admission. Don't delegate it, right? Don't delegate it until it's stable. He or she is stable. Your client is stable. Right? Now that's all I'm going to talk about on delegation. I'm not even going to post any questions here about delegation. So if you want to, if you need to repeat that, just go ahead and rewind the YouTube video, and you can hear it again. All right. Let me see what else is a top concept. Okay, I'm gonna say one more here because I like this one. I made it up. That's why I like it. No. But never pick the symptom of the disease. Did I already say that? I don't know, but never pick the symptom of the disease. And I'm gonna go show you what that means. I'm gonna post a couple questions here for you now. Okay, so let's do it. Catch you on the other side. Okay, as you can see by the slide that I have in front of us, this is a perfect example of two of my concepts, which is never pick the symptom of the disease and to pick pain. So, let's look at this example. I'll read it to you. The nurse has received the following information about assigned clients. The nurse should first assess the client. A. With ulcerative colitis who is reporting having bloody diarrhea. No, don't pick that. That's a symptom of the disease. Now, when your disease becomes acute, you might want to pick it. Like if they had ulcerative colitis, 4 bouts of bloody diarrhea in 6 hours, you may want to pick it. But in this case, you don't pick it because we never pick the symptom of the disease. B. With lung cancer who is reporting expiratory rust-colored sputum. Again, symptom of the disease. Don't pick it, especially if it's viral, right? So let's look at C. Who had percutaneous transluminal angioplasty, or PTA, 4 hours ago and is reporting flank pain. Or D. Who had a partial thyroidectomy 3 hours ago and is reporting incisional pain at a level of 6. Now we have a problem because I did not tell you, I just said pain, right? Now if you have to pick between two pain answers, always pick the pain answer that has a level and a scale. But don't mess yourself up and don't pick any pain answer if there is a physiological need. So if there's a level and a scale, but there's a physiological need, don't pick it. Don't mess up like that. All right? So in these two cases, between C and D, We want to pick D because it has a pain at the level of 6. All right. The percutaneous transluminal angioplasty just says flank pain. It's not saying to what extent they're having that pain. So always pick the level and the scale. This next slide is a perfect example of when I say when you're working with the interdisciplinary staff, you want to pick the scope of practice that's within their scope of practice with your client, not your scope of practice. Let me read it to you. The nurse is caring for the following clients. It would be a priority to initiate a referral to a social worker for A. A 32-year-old client recently diagnosed with Huntington's disease who is a single parent of a 10-year-old child. All right, let's keep that. That sounds like there might be a problem there. B, a 40-year-old client who has an external fixation device applied for a fractured tibia and fibula and lives alone. Let's keep that. That sounds like that might be a problem there. C, a 54-year-old client with breast cancer who has had a bilateral mastectomy and lives with her spouse. Well, she lives with her spouse, so that's okay. Don't pick it. Or D, a 68-year-old client who has had an MI and lives with a sibling. Well, who has had an MI, so they've had it some days ago, weeks ago, months ago, I don't know. But they live with their siblings, so they're fine. So C and D is out. So B is a problem because here we have a 40-year-old client who has 2 broken legs and lives alone. But we can fix that as nurses. This is within the scope of our practice to fix. What we do is we call up our supervisor and we say, "Supervisor, we have a problem. This person's living alone and they can't make their lunch, they can't take a bath, they can't do anything for themselves." And so supervisor says, "Oh, that's okay, Annalise. We'll send out 2 aides to help them, maybe do 12-hour shifts, right? 7A to 7P and 7P to 7A, something like that." You see how that problem is within the home health agency's scope of practice to fix. But let's look at a 32-year-old client recently diagnosed with Huntington's disease who is a single parent of a 10-year-old child. Now this is the answer because we're here to take care of the single parent, not the 10-year-old child. The single parent is in our scope of practice, not the 10-year-old child. So we're going to have to make a referral to a social worker for the 10-year-old child. That's the social worker's jurisdiction, right? That's within their scope of practice. We're there for the Huntington's disease individual. If he or she can't even take care of themselves, they certainly cannot take care of a 10-year-old child. And a 10-year-old child is not old enough to take care of themselves. So that is the concept of when you have an ancillary staff, someone else, in the question, you want to pick the answer that's within their scope of practice, not our own. So, you see, for the purpose of time, that's all I'm going to do right now for delegation and prioritization. I cover the whole thing very thoroughly when I tutor. And of course, another one you always want to remember for the NCLEX is to make sure that you put safety first for your client. I don't care if your coworker fell down the stairs. If your client is getting ready to fall out of the wheelchair, Safety is always first. If your client has gotten out of their vest restraint and your coworker is falling down the stairs, who should I pick? Pick your client. Make sure that your client is always safe. Safety is always first. All right, guys, let's go to another one. Let's go to, how about if I do some legal concepts? All right, so you're going to see legal concepts for the NCLEX Part 3. Can you look that up for me? And that'll be a big help to you. All right, guys, God bless. See you later.
You raise me